How to use the nutrition care process and ADIME in practice. The information in this video has been retrieved from the ENCPT Electronic Nutrition Terminology Reference Manual 2020 edition, which has been linked in the description of this video. This video is brought to you by DSC, an online learning platform and clients handouts hub for registered dietitians and dietetic students. Whether you are a student, dietetic intern, new dietitian, or a seasoned dietitian, you've probably heard about the nutrition care process. But what does it actually look like to apply it to practice? In this video, we break down the steps of the nutrition care process and ADIME charting to help you feel more confident applying them in practice. And at the end, you'll find nutrition care process examples for 3 different practice areas. Let's start at the beginning. What is the nutrition care process? The nutrition care process was developed by the Academy of Nutrition and Dietetics and is recognized and used internationally. It was designed to create consistency across the steps of nutrition care and includes terminology to keep the language used in documentation standardized. Knowing how to utilize the nutrition care process or ADIME documentation can help maintain organization in your practice. Basically, the NCP standardizes the steps to take when providing nutrition care to your patients or clients. The NCP comprises 4 steps. Following the 4 main steps of the NCP can help provide dietitians with a blueprint for nutrition care. Step 1 is nutrition assessment, Step 2 is nutrition diagnosis, Step 3 is nutrition intervention, and Step 4 is nutrition monitoring and evaluation. Let's break down what each of these steps includes. Step number 1, nutrition assessment. In the assessment stage, relevant information about the client is collected. The information collected will depend on the individual client, the reason you're providing care, and how you're obtaining the information. For example, a dietitian working in an ICU setting will likely rely heavily on the patient's recorded medical history, current medical data, and the health team to collect information for a nutrition assessment. Whereas a dietitian working in an intuitive eating-focused private practice will most likely collect qualitative data from the client themselves. So how do you know what information to collect in your assessment of a client or patient? For the most part, it will depend on your clinical judgment, but the NCPT can help by providing a list of options for assessment data to collect. The nutrition care process terminology for nutrition assessment is combined with monitoring and evaluation, but the main categories relevant for assessment include nutrition and food-related history. This includes food and nutrition intake, nutrition supplements, nutrition knowledge and beliefs, food availability, physical activity, quality of life, etc. Anthropometric measures and reports, such as height, weight, waist circumference, BMI, weight changes, etc. Biochemical data, medical tests, and procedures. These are labs and tests that are relevant for your nutrition assessment of the client. And nutrition-focused physical findings, such as physical appearance, swallowing ability, physical signs of nutrient deficiencies, as well as physical findings from a client interview or health record that might be important, such as vital signs, digestive issues, headaches, etc. Client history, relevant information obtained about the client's personal, social, or medical history, and assessment tools, such as results from a validated malnutrition tool. Once you've collected all relevant information and data, you will compare the data to normal values, nutrient requirements, or recommendations that would be considered appropriate for the client's condition or concerns. And assessment doesn't just happen once, but will require reassessment at different stages of the nutrition care relationship. The next step is nutrition diagnosis. At this stage, you will take all that you have learned about the client from your assessment and choose a main nutrition problem or diagnosis that you will be addressing. A nutritional diagnosis is not the same as a medical diagnosis. To communicate a nutrition diagnosis, PES statements are used. PES statements communicate the nutrition-related problem that can be improved or resolved by nutrition intervention. They help to summarize your nutrition assessment and give justification for the next steps of the nutrition intervention. A PES statement has 3 components: a nutrition-related problem, the etiology, the cause or the origin of the problem, and the signs and symptoms. These sections are combined in a structured sentence by the phrases related to and as evidenced by. The problem related to etiology as evidenced by signs and symptoms. For example, increased protein and energy needs related to increased demand for wound healing as evidenced by non-healing stage 3 pressure injury and unintentional weight loss of 8% in 3 months. For more information on PES statements and some PES statement examples, check out our PES statements video at the link in the description. Moving on to step 3, nutrition intervention. The nutrition intervention is the plan for resolving or improving the nutrition problem and etiology identified in step 2. The NCPT breaks down some categories for the nutrition intervention, including food and/or nutrient delivery, modifying the diet, texture, nutrients, or eating or feeding environment. Nutrition education, providing education to the client on a particular nutritional or lifestyle topic. Nutritional counseling, using certain counseling skills or theoretical models to help the client implement changes. And coordination of nutrition care. This could include referring to another professional or collaborating with a community partner to support the client. The nutrition intervention should include the plan or goal for the client, as well as the steps you're going to take to implement the plan. Take the time to ensure that your intervention is client-centered and collaborative, and includes consideration of the client, their needs and values, the interdisciplinary team, and you'll also want to ensure that the intervention is realistic with the timeline, urgency, and level of follow-up possible. Once the plan has been developed for nutrition care, monitoring and evaluation is next. Monitoring and evaluation includes crafting a plan for how you will determine the progress being made on the goals for the client identified in step number 3. You can look at the nutrition diagnosis and intervention to create strategies for monitoring those specifically. Monitoring and evaluation will likely include making an initial plan for what data will be collected at the next interaction with the client to be used for monitoring, collecting any relevant assessment data pertinent to the evaluation of the client, monitoring how the intervention is impacting the client, and comparing the information you collect to past data to determine whether changes need to be made to your diagnosis and intervention plan. Consider how often you can interact with the client to monitor their progress. Evaluation of how the client is doing nutritionally should be part of each interaction with the client. Now that we know about the NCP, what is ADIME? To simplify your chart notes and documentation of the NCP, you can use the ADIME documentation method. ADIME is just one charting format, but it works well with the NCP, and we think you'll see why. ADIME stands for Assessment, Diagnosis, Intervention, Monitoring, Evaluation. So, ADIME is the steps of the nutrition care process. And you can use the ADIME format to record the steps of your nutrition care progress with your client when creating a chart note. Now that we've covered the overall process, let's walk through how to actually apply these steps in practice with a few nutrition care process examples using the ADIME structure. These 3 examples represent different areas of practice, including celiac disease, polycystic ovary syndrome or PCOS, and nutrition support with enteral nutrition. Our first example will show you how to go through the steps of the NCP with a client who has a new diagnosis of celiac disease. Step number 1, nutrition assessment. The nutrition assessment for a client newly diagnosed with celiac disease might include obtaining data related to food and nutrition-related history, such as normal food intake, which could be determined with a 3-day food record or 24-hour recall, and relevant eating behaviors, such as how many meals and snacks they normally eat, what their eating schedule looks like, where and how they obtain food, etc. Knowledge, beliefs, attitudes related to celiac disease and their diagnosis. Overall lifestyle and physical activity details, including stress level, any relevant family or social history, any history of dieting or elimination diets, any supplements or medications they might be taking that could impact their nutritional status, and food access and ability to purchase gluten-free foods. Anthropometric data or measurements such as height, weight, and weight history if weight change is a concern for this client. Biochemical data, medical tests and procedures such as information about their celiac diagnosis, Was it a serology screen? Was a biopsy performed? Lab values such as CBC, iron, folate, vitamin B12, calcium, albumin, vitamin D, vitamin B6, copper, or zinc. Any other confirmed allergies or intolerances such as lactose. Any other relevant or concurrent medical conditions such as type 1 diabetes, inflammatory bowel disease, or arthritis. And nutrition focused physical findings, including digestive symptoms and their frequency, severity, and persistence. For example, loose stool, constipation, nausea, abdominal pain, or bloating. Once this data is obtained, you could assess the data for sources of gluten in the diet, sources of gluten cross contact, client readiness and motivation for change, and overall diet quality and nutrient intake. For example, are they eating adequate fiber, calcium, vitamin D, iron, B12, folate, etc.? Step number 2, nutrition diagnosis. Here's an example of a PES statement for celiac disease. The diagnosis would be individualized to the unique client and whether there is something that comes up in your assessment as a problem that needs to be addressed first. If the main issue is that the client is completely new to the concept of celiac disease and a gluten-free diet, a nutrition diagnosis with a food and nutritional knowledge deficit problem might make the most sense here. Note that limited food and nutrition knowledge is the NCP-approved synonym for food and nutrition knowledge deficit, and you can choose your preference for which you like better. Other potential problems might include inadequate fiber intake, inadequate intake of types of carbohydrate, inadequate vitamin and mineral intake, or less than optimal intake of types of protein or amino acids, i.e., gluten. Step number 3, nutrition intervention. If the main problem is limited nutrition knowledge related to the new diagnosis of celiac disease, nutrition education would be the main nutrition intervention. In this case, education may be around the importance of gluten avoidance, gluten-free food choices, and the identification of gluten-containing foods, label reading, and gluten cross-contamination. These topics are all covered in DSC's Celiac Disease video course, evidence summary, and client handouts. Step number 4, nutrition monitoring and evaluation. A monitoring plan for a client newly diagnosed with celiac disease may include food tracking, which could be used to assess compliance to a gluten-free diet, nutritional adequacy, and diet quality at future appointments, changes in digestive symptoms, changes in lab values, including nutrient deficiencies, changing in motivational level, or personal factors that may impact diet compliance. Our next example will show how to go through the steps of the NCP with a client who has PCOS. Your food and nutrition related history assessment may include their intake, such as through a 3-day food record or 24-hour recall, their knowledge, beliefs, and attitudes related to food, and their concerns regarding weight, cravings, fatigue, stress, subfertility, etc., eating behaviors, readiness or motivation to make changes, their access to food, lifestyle or physical activity information, and medications or supplements. Your anthropometric measurements may include height, weight, and weight history if these are concerns. And you may obtain biochemical data, medical tests, or procedures such as relevant medical history and history of concurrent conditions such as diabetes, lab values such as ones that indicate insulin resistance, inflammation, or micronutrient deficiencies, and nutrition-focused physical findings such as observations or client reports of acne, facial hair, digestive issues, etc. Once this data is obtained, you could assess for overall dietary quality and micronutrients. If there's a deficiency or a suspected deficiency, you could assess for the glycemic index of the majority of carbohydrates eaten, the overall fiber intake, omega-3s, anti-inflammatory versus pro-inflammatory foods, etc. Fluid and beverage intake. Are they drinking sugar-sweetened beverages, alcohol, etc.? What is their meal and snack frequency? What is the macronutrient distribution of meals? And then from this, you can come up with your nutrition diagnosis. Of course, your nutrition diagnosis would be individualized to the unique client and any pertinent concerns they may have. In an outpatient setting, it can be sometimes tricky to choose a main problem to focus on. Considering the client's needs and desires and practical interventions may be helpful in choosing a problem to focus on first. An example of a PES statement: if the client you are seeing could benefit from eating more fiber, and this goal your client is eager to achieve, it may make sense to start here. So we could say inadequate fiber related to low intake of food sources of fiber, as evidenced by dietary recall showing low intake of vegetables, fruits, whole grains, legumes, and high intake of low fiber carbohydrate food, and client report of constipation and feeling hungry shortly after meals. Depending on the unique needs of your client and the established problem, your intervention may focus on education or goals related to choosing higher fiber or lower glycemic index foods, meal and snack timing and frequency, mindful eating, anti inflammatory foods, macronutrient distribution, and blood glucose management. And of course, this will all depend on your specific nutrition diagnosis. Intervention could also be counseling related with a focus on goal setting or motivational interviewing. A monitoring plan for a client with PCOS may focus on the client's self tracking of their food intake, a food and mood diary, changes in lab values or blood glucose, and/or physical findings, for example, weight changes, if that was a focus of the intervention. Evaluation will depend significantly on the client's goals. In the case of our diagnosis of inadequate fiber intake and a planned intervention to address that, the evaluation may be related to assessing the client's food records for changes to their estimated intake of fiber and resolution of fiber related symptoms such as constipation and hunger after meals. This final example will show you how to go through the steps of the NCP with a client who has been referred to the dietitian for an enteral nutrition plan. Your nutrition assessment may include obtaining data related to food and nutrition related history, such as nutrition and intake history, their oral intake, days NPO, etc., their normal intake, and your assessment will also include their energy, protein, and fluid needs. Anthropometric measurements such as height, current body weight, usual body weight, and weight history, biochemical data, medical tests and procedures, related to enteral feeding, clinical or medical data related to enteral feeding, any nutrient deficiencies on labs, current medications, any past or planned surgeries or procedures, and nutrition focused physical findings such as physical appearance, skin fold thickness and mid-arm circumference, swallowing ability, digestive capability, like bowel sounds, any nausea, vomiting, diarrhea concerns, and client history, any relevant family, social, or personal history, and financial means to afford enteral formula. Also, assessment tools such as results from a malnutrition screening tool. In a clinical setting where enteral nutrition is recommended or considered, the nutrition diagnosis is often related to intake. For a diagnosis related to intake, the intervention of enteral nutrition will address this problem. Diagnosis related to inadequate or inappropriate enteral or parenteral nutrition may also be considered if the client is already prescribed nutrition support and is in need of a change of formula or delivery method. Clinical status, including involuntary weight loss, may also be considered a main problem. Our example PES statement here is inadequate oral intake related to swallowing difficulties, as evidenced by abnormal swallow study, unintentional weight loss of 6% in 1 month, low mid-arm circumference, and low hemoglobin levels. Compared to the previous examples where education and counseling were the most logical interventions, in this situation, food and/or nutrient delivery will be the category of intervention to address. Your intervention may be related to determining the feeding schedule, determining the formula and total amount required to meet needs, determining the feeding rate to meet the goal, determining the risk of refeeding, and calculating water flushes, etc. From this, the final enteral prescription will be your main intervention, along with any goals for weight gain and education required. Referral to community supports may also be part of the intervention. Our monitoring plan will include looking at ins and outs, nutritional intake, energy, protein and fluid, and bladder and bowel outputs, gastrointestinal symptoms and changes, blood work changes, weight changes, tube placement, and medication changes. Evaluation of any changes in nutrition indicators may require future interventions related to bolus feeds prior to discharge to improve normalcy, ensuring enteral formula is covered for home use, trialing oral intake if possible, weaning off of enteral nutrition, and collaborating with community supports. So let's recap. The nutrition care process involves 4 steps: assessment, diagnosis, intervention, monitoring, and evaluation. Dietitians can use the NCP as a consistent methodology to guide nutritional care. ADIME charting incorporates the steps of the NCP into a documentation style. And the nutrition care process terminology can be used as part of the NCP to communicate the assessment, diagnosis, intervention, monitoring, and evaluation. Share this with a friend or colleague who would find it helpful.